Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone, today we're going to talk about Dipyrone, also known as metamizole. In this video, I'll give you a complete guide on how and when to use it. Dipyrone is a medicine that mainly helps to relieve pain and reduce fever. It is very useful for strong pain, like after surgery, or for high fevers when other medications don't work. So how does Dipyrone work? What it does is block your body from making substances that cause pain and fever. This is how it helps reduce inflammation and makes you feel better. Regarding the dosage, it is super important to follow what your doctor tells you. Normally, you start with a low dose and adjust it according to how it's working for you. For adults, the starting dose is usually 500 milligrams, and then the maintenance dose changes depending on the intensity of the pain or fever. However, never take more than the recommended dose. Like all medications, Dipyrone can have side effects. The most common ones are stomach discomfort, dizziness, and in very rare cases, severe allergic reactions. You have to be aware of anything strange that happens to you and talk to your doctor if you have any question. One super important point: never take Dipyrone without a doctor's prescription, especially if you have health problems or are taking other medication. Always inform your doctor of any other treatment you are taking. Finally, Dipyrone can be very effective if used correctly. Always follow your doctor's instructions and read the medication information leaflet carefully. Take care and talk to your doctor if you have any questions. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.